Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to the Nourishing Traditions, and today we will be myth busting diabetes mellitus. So I'm going to discuss type 2 diabetes mellitus in this video from the book of Sally Fillon and Tom Cowan, The Fourfold Path to Healing. Scientists discovered insulin in 1920s. Insulin, which helps sugar to go from blood into the body cells. When this transfer cannot take place, we call it diabetes. And although there are a lot of improvements made in diabetes or in treating diabetes, but still it is one of the leading causes of death because it leads to other problems such as heart diseases and circulatory problems and kidney problems and neuropathy, then degeneration of retina and foot ulcers to gangrenes, numbness, tingling sensation in the extremities, burning in the extremities, and high risk infections. There are two types of diabetes, and in this video we will be discussing diabetes type 2, which is a very common form of diabetes, and this is actually a new perspective which diabetes require from the medical professionals, and in this video we will be discussing those perspectives. Diabetes epidemic in the world and why conventional medicine for this scourge has made no dent in the long-term effects or long-term impact on those who suffer from diabetes. Now we need to dive in the biochemistry to understand this disease. The ADA recommends the following criteria for sugar goals. So fasting is less than 100 milligrams per deciliter. Then you have pre-prandial, which is before meals, and that's between 70 to 130 milligrams per deciliter. Then we have post-prandial, which is 1 to 2 hours after eating, and that is less than 180 milligrams per deciliter. Then at bedtime it should be between 100 to 140 milligrams per deciliter. So how is diabetes diagnosed? A diagnosis of diabetes is usually made when the fasting sugar is 126 milligrams per deciliter, or HbA1c is 6%. That's the blood sugar, average blood sugar over 3 months. So if your fasting blood sugar levels are between 100 and 126 milligrams per deciliter, your doctor might diagnose you as pre-diabetic. So the blood sugar which goes high, our body has only two mechanisms to deal with it. And number one is exercising, which really helps the blood sugar to go into the cells, and it drives that muscular activity, which helps the muscle cells to get involved in absorbing sugar from the blood. If your blood sugar drops below 40, you might become disoriented, confused, and if the situation persists, you might slip into coma. Between 40 to 60, you might feel shaky, jittery, anxious, confused, sweaty, irritable. And when the blood sugar levels are above 60, between 60 to 80, the same symptoms occur but less severe. So we're going to discuss body's coping mechanism. That's when the sugar level starts declining and it begins to drop below 80. The body starts producing these hormones, principally adrenaline and glucagon. The main effect of adrenaline is to make sugar available to the cell. Production of adrenaline accounts for the familiar shaky, jittery feeling that may have experienced during the hypoglycemic periods. So this is how the body responds to very low sugar levels. Body to cope up with less sugar, it also releases glucagon, which helps raise sugar by breakdown of fat. So this is simply converting fat into sugar. Fat molecules are converted into sugar, and this raises the blood sugar levels. So this is how our body adapts, and there may be 10 or more biochemical or hormonal reactions within the body when it goes into a hypoglycemic state. And another adaptive physiology, which is the release of growth hormone. As you can see, the body has multiple overlapping mechanisms to prevent fall in the blood sugar, and the situation is, however, very different when the body goes into a hyperglycemic state. Many times diabetic patients, they have complained of feeling tired, and routine checkups have shown 400 milligrams per deciliter blood sugar, which is 4 times the normal blood sugar levels. So these people are at greater risk of coronary artery diseases and neurological diseases, but their bodies, they do not adapt and they do not show any alarm or any warning against the rise in blood sugar. So let's discover why it is so. Some doctors have conjectured that body has a hard time dealing with hyperglycemia because the conditions that causes hyperglycemia, namely overeating, they are relatively a new phenomena in human history, whereas hypoglycemia is an old phenomena and the body has been frequently dealing with it in the past, and it has different coping mechanisms to deal with lack of sugar or lack of food. So the blood sugar which goes high, our body has only 2 mechanisms to deal with it. And number 1 is exercising. It really helps the blood sugar to go into the cells, and it drives that muscular activity, which helps the muscle cells to get involved in absorbing sugar from the blood. So the second coping mechanism to deal with high levels of blood sugar is the release of insulin. And insulin production is one of the body's way of converting these high sugars into fat and storing them in the body. Insulin helps remove fat from the blood, and the interesting thing here is that all the sugars are converted into saturated fat, which is cholesterol, and it's also known as animal fat. So why is insulin converting excess sugar into saturated fat? In order to understand diabetes, we need to understand how the body copes up with hypoglycemia, hyperglycemia. And thank you for watching this time. In my next videos, we will be myth busting about the hyperglycemic state and how the body copes up with it. So stay tuned, like, share and subscribe. Ma salama.